Hi, I'm Earl Silman, Editor-in-Chief of the Journal of Rheumatology. And for the month of July 2021, the article I have picked for my interview is entitled Feminization of the Rheumatology Workforce, a longitudinal evaluation of patient volumes, practice sizes, and physician remuneration. And it is by Dr. Jessica Widdifield and colleagues from the University of Toronto, University of Western Ontario, University of Calgary, McMaster University, and McGill University, all in Canada. The paper is now available for open access at our website at jrheum.org. Please have a look at it. And today I am pleased to be speaking with Dr. Widdifield, who is the first author of the paper. Jess, I want to thank you for taking the time to speak to me and our listeners about your very interesting and certainly provocative article, I'm told, regarding feminization of the rheumatology workforce in Ontario, Canada. So we'll move along, and could you please highlight the important findings of your article?
Thank you so much for inviting me to highlight the important findings of our study. So we compared the clinical activity and compensation between female and male rheumatologists by conducting a population-based study of rheumatologists practicing in Ontario, Canada, and their patient visits over a 15-year period. And we found that on average, male rheumatologists saw more unique patients each year, and they had significantly higher patient volumes. And as a result, male rheumatologists had significantly higher earnings. And even after controlling for age and year, female gender was still associated with lower practice sizes and practice volumes. And considering that rheumatology workforces are already strained by too few physicians in face of the growing burden of rheumatic diseases, and that our findings highlight key differences in volume of services between males and females, it's very important to account for the demographic shifts that are occurring within the workforce when undertaking future rheumatology workforce planning to ensure that our population needs are being met.
Good, thank you. And so what really led you to undertake the study?
There were a few factors that led us to undertake this study. First, in a previous study done by our team, we observed that the annual percentage of the Ontario population seen by rheumatologists has remained relatively constant over time, yet we know that the burden of rheumatic diseases is increasing in the population, and so there's likely an increasing need for rheumatology care. Yet the new consultation rates to rheumatologists are not increasing in the way we would hope to see. And then second, we were aware of the significant increase in female rheumatologists within the workforce, and previous studies that were mostly from primary care have reported that on average, female physicians tend to work fewer hours than males and are more likely to work on a part-time basis and also take periods of leave. So we wanted to better understand if this may be true for rheumatology as well, and whether the gender shift may have implications for future physician supply and patient access.
So that leads really to my next question. Really, how generalizable do you think your findings are to both Canada and other countries?
That's an important question. Our study only examines the gender differences in clinical activity and earnings in one Canadian province, although Ontario does contain the largest rheumatology workforce in Canada. However, across Canada and most countries have all seen an increasing representation of female rheumatologists over time, which is a positive thing to see. Other medical specialties have also documented similar trends occurring worldwide in terms of gender differences in patient volumes and earnings. So I do believe our study is quite generalizable to other settings.
Yeah, I was really intrigued that the median practice size for both female and male rheumatologists decreased from the years 2000 to the year 2015. Yet the total practice volume was stable for males, but there was a trend for decline in female physician practice. Would you like to comment on the significance?
Indeed, that's a very interesting finding. Practice sizes reflect the number of unique patients seen each year, and this decrease in practice sizes over time is something we might expect to see. There are many patients who are referred to rheumatologists who require chronic or ongoing patient care. So once these clinics become saturated with these patients requiring ongoing care, there are fewer opportunities to accommodate new patients. So it makes sense that for both genders, we do see a decline in the number of unique patients seen annually. But when it comes to patient volumes, this reflects the number of patient visits, as some patients may be seen multiple times throughout a year. As to why patient volumes are declining over time amongst female rheumatologists, there are likely several reasons to explain this. In general, the increasing number of female rheumatologists entering the workforce are younger than the other established workforce members, who are predominantly older males, and they're also just starting off their practice. The reductions may also reflect the trend among younger cohorts of physicians to have fewer patient visits compared to older generations, as they're trying to improve their work-life balance. We did see, however, that practice volumes increase for middle-aged women. So another explanation is that younger women have additional demands on their time, such as greater family caregiving responsibilities. And unfortunately, we did not have information on gender-related differences like marital status, family size, and childcare roles, all of which could contribute to the relationship between physician gender and practice level activity. But the major significance of these findings is that because female rheumatologists see fewer patients, increasing feminization of the rheumatology workforce may lead to longer patient wait times and reduce clinical capacity of the overall workforce, which is already strained by too few physicians. On the other hand, we also need to better understand whether female physicians are receiving adequate supports when they start their practices, which often coincides during a time when they have young families. Additionally, practice volumes are not a substitute for quality of care, and we need to strive towards value over volume.
Well, it sounds like you have your whole career just examining this. These are very important, relevant, and intriguing, especially as a male. You know, it's not irks me, I guess is the right thing, and being somebody who took off time with my kids to be with them, I just wish more males would have the same attitude as females. But that's just my editorialization. So my last question, any suggestions that we can address some of these inequalities, if that's what they really are, and where we should go?
That's very important. As you know, gender-based disparities are well documented in medicine. The explanation for gender-based differences that we observed are likely multifactorial, but our findings do highlight the need for system-level solutions to ensure the sustainability of the global rheumatology workforce and ensure there is adequate supply as well as support for rheumatologists to meet growing patient demands, especially in light of this increasing feminization. And healthcare systems need to address the shortage of rheumatologists in many areas of Canada and globally by focusing on increasing recruitment. And we also need to focus on enhancing workforce capacity by other means, such as with allied health practitioners, as clinical service capacity may be increased by models of care that integrate the work of multidisciplinary care teams, thereby shifting some of the workflow responsibilities and access to programs. And we also need to better understand ways in which we can better support women in medicine. Others have shown that the gender gap in medicine is not simply explained by women working less, but rather it relates more to systemic bias in medical school, as well as hiring, in the promotion processes, as well as clinical care arrangements, mechanisms that are used to pay physicians, and also, importantly, societal structures more broadly.
Thank you. That's excellent. I mean, I think we do have a lot to do for this, and hopefully the points you brought out in your paper and that we discussed will lead to improvements for everybody, our patients, us, just everybody in general. So I want to thank you for taking the time to speak with me. And to our viewers, please read the full-length article entitled Feminization of the rheumatology workforce, a longitudinal evaluation of patient volume, practice sizes, and physician remuneration. And it is by Dr. Widdifield and colleagues, and there's an accompanying editorial entitled The Evolving Workforce in Rheumatology, the Effect of Gender, Grace White from the Association of Women in Medicine Rheumatology in New York. So we'll get another country view on this. And they're both available at jroom.org. So we'd love to hear your comments on Twitter at jroom or by email manuscripts@jroom.com. So I want to thank you for joining us. Thank again, Dr. Widdifield, and hope next month you'll listen again when I was speaking to one of the authors from my August picks. So bye for now and stay healthy until we all get better immunized.